As a practicing urologist and a certified specialist in both sexual medicine and nutritional therapy, I'd like to discuss a topic that isn't just relevant, it's often overlooked, yet fundamentally important. The intimate connection between your dietary intake and your sexual health, particularly penile function, cannot be overstated. While many organs reflect your general well-being, few translate lifestyle choices into performance outcomes as directly as the penis. Today, we'll explore the 5 most evidence-supported supplements that can significantly improve your vascular and sexual health without falling prey to fads or misinformation. It's important to preface this by saying that dietary supplements, while accessible over the counter, should never be taken lightly. If a compound has biological efficacy, it acts more like a pharmacologic agent than a benign food item. Therefore, it's critical to approach supplementation with the same respect and caution you'd apply to medications. Let's begin with leafy green vegetables. Though not a supplement in the traditional sense, leafy greens deserve a place at the top of any list aimed at vascular optimization. Arugula, spinach, kale, beet greens, and their relatives are rich in dietary nitrates. Within the body, nitrates are converted into nitric oxide via the enterosalivary pathway, a unique route that doesn't depend on amino acids or liver metabolism. Moreover, these vegetables are rich in antioxidants, fiber, folate, magnesium, and various phytochemicals that support blood pressure regulation, endothelial repair, and hormone balance. From a nutritional science perspective, they enhance virtually every parameter associated with erectile function. It might surprise you to learn that, according to recent CDC data, fewer than 10% of American men regularly consume leafy green vegetables. This nutritional gap represents not just a missed opportunity, but a clinical risk factor for cardiovascular and sexual dysfunction. Let me refer to a compelling case study: a heart disease patient with complete erectile dysfunction who reversed his condition purely through dietary changes. After increasing his intake of leafy greens and plant-based foods, not only did his vascular health improve, so did his sexual function. His experience illustrates the profound interconnectedness between food and performance, between what's on your plate and what your body can do. Moving on to our 4th supplement, zinc. Zinc doesn't directly impact penile vascular function, but it is vital for overall reproductive health. It plays a substantial role in supporting testosterone biosynthesis, sperm motility, and prostate function. However, there's a widespread misconception. Unless you're clinically deficient in zinc, supplementing with high doses will not boost testosterone further. In fact, excessive zinc intake has been associated with increased risk of aggressive prostate cancer due to alterations in cellular proliferation and immune modulation. Laboratory testing should always precede zinc supplementation. A simple blood panel can indicate whether your serum zinc levels are suboptimal. Populations most at risk for deficiency include individuals on highly restrictive diets, such as vegans or those with eating disorders, those with gastrointestinal absorption issues, and patients with chronic inflammatory conditions. In such populations, targeted zinc repletion can restore hormonal balance and improve reproductive metrics. But it bears repeating, inappropriate or sustained oversupplementation can carry more risks than benefits. Let's now unveil what I personally rank as the most potent supplement in this category: Pycnogenol. Pycnogenol is derived from the bark of the French maritime pine tree and represents a concentrated source of naturally occurring polyphenols. These compounds are potent antioxidants and anti-inflammatory agents, and their benefits aren't theoretical. They've been substantiated through several clinical trials. What distinguishes Pycnogenol is its capacity to directly enhance nitric oxide synthase activity in endothelial cells. In simpler terms, it boosts the body's own ability to produce nitric oxide while also protecting vascular integrity from oxidative damage. This double action is particularly relevant as oxidative stress is one of the leading contributors to erectile dysfunction, especially in aging men and those with metabolic syndrome or cardiovascular disease. Even more compelling are clinical trials showing that the concurrent use of Pycnogenol with L-Citrulline or L-Arginine produces significantly greater improvements in erectile function than any of these substances used individually. The trilogy, citrulline, arginine, and pycnogenol, often forms the foundation of some of the most reputable natural male enhancement formulas used today. The power of this supplement lies in its ability to act as a biological amplifier. While it doesn't cause erections independently, it enhances the endogenous processes that make optimal sexual function possible. Next, we turn to L-Arginine, another nitric oxide precursor that has been extensively studied for vascular and erectile performance. Biochemically, L-Arginine functions similarly to a supplement that is number 1 on the list. Both ultimately enhance nitric oxide availability. However, L-Arginine faces a significant biological hurdle. First-pass metabolism. Upon oral ingestion, a notable percentage of L-Arginine is metabolized in the liver before reaching systemic circulation. This makes it somewhat less efficient as a standalone supplement compared to citrulline. That said, L-Arginine is not obsolete. In fact, when used in conjunction with citrulline, it may offer greater benefits than either alone. Studies suggest that their synergistic action improves blood flow beyond what either compound achieves independently. Thus, although L-Arginine may seem like a more traditional approach, its role remains scientifically supported, particularly when part of a combined protocol targeting vascular enhancement and erectile function. So, top of the list is L-Citrulline. Citrulline is a non-essential amino acid that plays a pivotal role in enhancing nitric oxide production within the endothelium, the delicate inner lining of your blood vessels. Nitric oxide is the principal molecule responsible for initiating and sustaining an erection. It operates as a vasodilator, relaxing smooth muscle tissue and increasing blood flow to the penile corpus cavernosum. However, nitric oxide cannot be supplemented directly in an effective or safe way. Instead, its precursors are employed. This is where L-citrulline has earned its spotlight. Upon ingestion, citrulline is converted in the kidneys to L-arginine, another amino acid that is then utilized to produce nitric oxide. Not only is citrulline more bioavailable than direct L-arginine supplementation, meaning your body uses it more efficiently, but it also remains active in the bloodstream for a longer duration. In practical terms, supplementing with citrulline improves endothelial nitric oxide synthesis, thereby increasing erectile hardness and responsiveness. Clinically, this makes it particularly helpful for individuals experiencing mild to moderate erectile performance concerns, especially when driven by poor circulation or endothelial dysfunction. As for consumption formats, citrulline is generally well tolerated. Most commercially available preparations provide functional dosing guidelines. One piece of advice from both research and experience: opt for capsules over powder. The powdered form has an odor and taste profile that can be off-putting, largely due to volatile sulfur-containing compounds formed during processing. Supplements have their place, but the foundation of sexual health rests on comprehensive lifestyle adjustments, from nutrient intake and stress management to exercise and sleep hygiene. Each supplement discussed today, L-citrulline, L-arginine, Pycnogenol, zinc, and leafy greens works through well-studied biological mechanisms, validated by peer-reviewed research. But always remember this: no supplement replaces the need for medical evaluation. If sexual dysfunction persists, consult a licensed healthcare provider. Your health deserves a tailored, evidence-based approach. I'm Dr. Fiona, and I hope today's overview gave you better insight into scientifically driven solutions for improving male sexual function safely and effectively.